Right now, we want to turn to the coronavirus here in our state.
Connecticut is in a good place.
The nation's top doctor addresses Connecticut. The state is still a nationwide leader in low infection rates, and that's why Dr. Anthony Fauci says in-person learning should happen this year. Eyewitness News is your back-to-school authority, and tonight Matthew Campbell joins us live with the information straight from the doctor. And Matthew, did hearing from Dr. Fauci give schools more confidence?
Well, Aaron, he gave us the pros and cons of going back. He's still for it, but the schools are really going to be an experiment. Remember, they were shut down quickly in March, so there's really no way to gauge how children will respond if there is an outbreak.
Connecticut's coronavirus numbers continue to be a bright spot at a time when most of the country looks bleak. Through protests, 4th of July parties, and numerous flights from hotspot states, for more than a month, our infection rate hovers around 1%.
You now are, in many respects, have the upper hand because you have such a low rate that when you do get new cases, you have the capability of containment.
Dr. Anthony Fauci joined the governor at his daily briefing where he's in agreement with Lamont and the president on schools.
You have a low baseline. You're at a percentage that really is quite low, that you should be able, with care, to open up for in-person learning.
The nation's top infectious disease doctor says in-class learning is the best for kids' psychological health, in some cases nutritional health, and it allows parents to work without needing to find childcare.
If the infection rate is so low that there's very little chance of there being infection spread, then you should feel okay about doing it.
Even with that said, Fauci admits there are going to be risks. He shares new information about how the virus impacts school-aged children between 10 and 19.
When they're infected, can transmit infection to adults as well as adults can transmit to adults.
The younger ones, too, are not immune like many initially thought.
That when you look at the level of virus in the nasopharynx of children, it's 10 to maybe even multiple more times amount of virus in the nasopharynx of younger children compared to the older children. And if you have that amount of virus in your nasal passage, you need to assume that that child can transmit the virus to someone else.
Dr. Fauci presented both sides today, and that gives superintendents like Dr. Joseph OLZACKI some tough choices.
And Dr. Fauci's his interview today was inspiring in that he gave us some of the answers that people, maybe myself included, didn't get before. But he also left questions, is that where is this going to go?
Back in March, OLZACKI, the superintendent of Region 14 schools, was the first in the state to close down. His schools, like all in the state, have plans to reopen in less than a month. He understands his decisions could mean life or death.
I have to make sure our children are protected, our faculty is protected, our parents are protected. And it's an awesome, think about this, going to bed every night, you wonder, am I doing enough?
Now, ending on a positive note, we've all been hearing about a second wave in the fall. And for the first time, at least for me, we heard Dr. Fauci say Connecticut might not see one. He goes back to the low infection rate, saying our baseline is very low, meaning when the inevitable spike comes, we should have the capability to contain it if we keep following the guidelines. Live above the newsroom, Matthew Campbell, Channel 13 News.